Hey everyone, so it's me, Ben, or GNC Centric. Today I'm going to do a very different video. I'm going to talk directly to you, the dysphoric person who is considering transition. So, first things first, you need to figure out if you have sex dysphoria, gender dysphoria, or body dysmorphic disorder, otherwise known as dysmorphia. Um, so sex dysphoria is internal. It has to do with self-perception and it's personal. Um, so I'm just going to explain my definition of it. So discomfort with your body, primary and secondary sex characteristics, genitalia, and sexual behavior expected of you because of your birth sex. This can manifest in self-harm, fantasies of changing your body, hallucinations, panic attacks, and dissociation, among other symptoms. Um, so gender dysphoria. Gender dysphoria is external. It has to do with other people's perception, and it's interpersonal. So this is kind of my description of it, is discomfort with gender roles and gender expectations forced upon you because of your birth sex. After transition, this can manifest itself in a constant anxiety about whether or not you are passing, whether your mannerisms are manly enough or feminine enough. Yeah. And then dysmorphia. So it's an uncontrollable obsession with a specific body part, which makes it hard for the person in question to focus on anything else, which can lead to low self-esteem and social problems. So that sounds very similar to dysphoria, but dysphoria has to do specifically with the sex characteristics, and it has to do with you wanting to switch sex, not just being uncomfortable with it. Like, there are lots of women who are very unhappy with the appearance of their genitals, but they don't want to transition to be the other sex, so that's dysmorphia. Um, there are a few like crossover things that are kind of dysmorphia and dysphoria, so I'm just gonna explain those quick. So having too big hips or too big shoulders, having a too big jaw, having too big or too small hands, being too tall or too short. So all of these things could be dysmorphia, but if they're in the context of other sex dysphoria and it has to do specifically with how other people are perceiving your sex, then I think it falls under the category of dysphoria. So you have dysphoria. What is your next step? Contrary to what Tumblr tells you, your next step should not be to run to the doctor and get hormones. Your next step should be to go to a therapist, a counselor, a psychologist, or a psychiatrist. Um, Anyone who can push you and ask you questions about the deeper problems in your life that might be contributing to this. So somebody who will not only affirm and validate you. If you go to a gender therapist, all they'll do is say yes, 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 and get you hormones, which is not productive. Like, what have you learned about yourself? So you need to find somebody that you're comfortable with, that you can be like really raw and personal with, so you can discuss like your sexuality and stuff. Yeah, if I were you, I would just, on the very first appointment, tell them I'm not looking to just be told, yes, you're trans. I want to explore what's going on. So I'm just going to mention a couple of things that I personally know quite a few trans people have had an issue with that has compounded their dysphoria. So, trauma. Quite a few trans people have sexual abuse in their past. They have family or parental abuse in their past, or domestic violence. So, obviously, trauma affects someone's self esteem, it affects their self perception. Sexual trauma will affect how somebody, their comfort levels with their own sexuality and how they see themselves sexually. So, it's really obvious to me that this can very, very closely be associated with dysphoria. Any other like general, more common mental health problems you might have? So, like if you have an eating disorder, or anxiety, or depression, or borderline personality disorder, or compulsive tendencies, or schizoaffective disorder, or whatever you have, address that, figure out how to handle that and live with that so that it is not one of the big problems in your life. Because a lot of people transition, and then after they transition, if they commit suicide and people look at why, it's because of their untreated other mental disorders. So get treatment and keep getting treatment. Yeah. So your family. So as I mentioned, the sexual stuff, of course, if you have sexual trauma from your family, you should address that. But also people who come from religious or conservative families where the idea of what is a man and what is a woman and like marriage is between a man and a woman. Sorry, my cat, 1 second. Let me not do that. Okay. Yeah, so they see like what is a man, what is a woman, marriage is between a man and a woman. So in their mind they can't conceptualize themselves being like homosexual. So like from a young age they start to bend it that they're the opposite sex so they can be with the people that they desire or something like that. Also, some people I know they transition within like a year of a death in their family. I'm sure any therapist that would immediately send up a red flag, something is up. Yes. Then body image and self-esteem. So I think there is a lot of females on Tumblr who are trans-identified who they just can't see themselves fulfilling like the sexual and social roles of a female. So they're trying to like escape that by calling themselves non-binary or by identifying as trans men. Like you can't live a happy and fulfilled life when you're just running from something. I think you need to address what's going on inside of you, really. Yeah, a lot of trans people have issues with perception and control. So how others perceive you, how you perceive yourself. Sorry, my cat. How you have control over your body and you don't have control over the way people see your body, that kind of thing. If you have ADHD, as I do, or autism, I think that also affects the way that you perceive the world and the world perceives you and how you interact with the world. So that's something worth definitely discussing. And then sexuality. So this is like obviously a huge topic. But anybody who tells you sexuality has nothing to do with gender is like they haven't put literally any thought into it. Like gender roles are designed for heterosexual people. So just by being a homosexual, you already are rejecting gender roles. So when you consider like if I was like living as a man, but I never had the genitalia, I couldn't actually perform sexually as a man. Like that has a big effect on your psyche. So I think in therapy you should figure out who are you attracted to. For I think a lot of young trans people, like they're just too young, they haven't been attracted to people yet, or they haven't had any sexual experiences yet. Like you don't need to rush into it and put a label on yourself right away. So what sexual roles excite you, or what sexual roles disturb you? Because I think that can be very telling. Are you capable of self-pleasure? I think that's an important step in being connected with your body. And also exploring how your self-pleasure affects your dysphoria. And have you been with somebody else sexually? Because, like I said, a lot of this has to do with perception. So, how is your partner perceiving you? How does that affect you? How does your perception of your behavior in front of your partner affect you? That kind of thing. And to see yourself in a sexual context with someone else. Yeah, I think that's super important. That almost never is talked about. And then the final thing, your actual dysphoria. So some people, they have help, they've been helped by cognitive behavioral therapy or dialectical behavioral therapy, and just like what are the roots of your dysphoria, and what alleviates your dysphoria. So for some people, after all of this therapy and all of this counseling and discussing all these issues, they will have found like this is the root of their dysphoria, and after all of these coping mechanisms and after like freeing yourself of all of these issues in your mind, that your dysphoria is way less. And if that's the case, you don't need to transition. I'm not telling anybody that they should or shouldn't transition. I'm telling you that you have the option to stop wherever you'd like along like the path. And I'm telling you that it's within your power to take a step forward or take a step backwards. Something else that I think should be discussed or explored that's never discussed or explored. I don't know why, if a child or a teen or a person feels uncomfortable with the gender roles assigned to them based on their sex, why not let them experiment with the other gender roles? Like, if I was given time to be a gender nonconforming female before I became like a trans man trying to pass, I don't know how that would have felt, but maybe that would have made a difference to me. And I've talked to some other people who said that might have made a difference to them too. So I think that's a pretty big step. So like what I mean is like you can dress how you like. Like if you want to wear boxers and a binder, like you can do that but still be female. If you want to wear makeup and like a dress but you're a male, you can still be male. Like just do what you want to do, but don't worry about identity is what I'm saying. If that's helping you to cope with your dysphoria, like great, maybe that's how you can live your life. If it's making your dysphoria worse, then like go talk to your therapist or counselor and figure out what's going on. Even if it's making your dysphoria worse, it's telling you something. You're learning something about yourself. So say you've taken all these steps and you've tried being a gender nonconforming person of your own sex, and you still think that transition is the right path for you. So very, very first thing, don't do any of this stuff if it's going to make you unsafe. If coming out is going to make you unsafe, do not come out. Figure out how to make yourself safe and then come out. Or even with the gender nonconforming stuff, if you can't be gender nonconforming in front of your parents because they're like really conservative Christians or something, wait until you move out, or find a way to move out and then experiment with that kind of thing. Like, always be safe. That's my priority. Please be safe. Okay, so say you want to transition. So, it's actually much easier to transition now than some people make it seem. Like, I know most people at school, they don't actually have many problems, that kind of thing, but the biggest issue is usually family, so I'm not going to tell you how to come out, it's like a whole complicated thing. Then also what people usually deal with is they feel like they're a fake, or like they're an imposter, or they're not really trans. So I would talk through those feelings with your therapist or counselor, and if you have like guilt over making people change your name and pronouns, or like over disturbing people with the changes you're making in your life, like talk through that. And at every step, ask yourself, is this making your dysphoria better or worse? So if you socially transition and your dysphoria is worse, like figure that out. It's telling you something. So say you've socially transitioned and things are slightly better, but you still see your path as being full medical transition. So let's talk about hormone replacement therapy. So there's like two main ways that, according to my research, people experience hormones. So some of them experience it as a second puberty, which if you remember your first puberty, or if you've heard people talk about puberty and you haven't experienced it yet, that can be horrific. Puberty is pretty bad. So if you haven't gone through all the therapy I suggested, you might not have the mental health and the coping mechanisms to experience a second puberty. Do you know what I mean? So I think that's really important. For other people, it's like a honeymoon period. It's like as soon as they took hormones, they were like, oh, everything is better. And for those people, some of them, it's like 6 months, a year that they feel perfect, and then they have a crash and they're like depressed. And for others, it just stays like that. So it's hard to know which one you are until you try it. I'm not telling you just go try hormones. I'm telling you discuss every possible other solution with your therapist first, and then if you see that that's the next step you have to take, then take that step. So before we even actually talk about actual hormone replacement therapy, I just want to talk about informed consent. I don't think how many teenagers realize, like, if you start if you take it for more than 5 years, you're probably going to have to get a hysterectomy because your uterus will atrophy and then you'll be at huge risk for infection, like, which can be fatal. I mean, you have like basically you'll have like a dead organ in your body. Or how this affects your like your bones, so osteoporosis, or increases your chance of heart disease, or increases your chance of cancer. I'm not saying this to shame anyone or to scare anyone. I'm just being real with you. If you're living in so much despair every day that you need to go on hormones to be happy, like, that's your choice. But I just think people really need to understand the possible risks associated with long-term use of hormones. Okay, so blockers. First of all, blockers are literally toxic. That's how they stop your puberty. Most of them are like off-brand drugs for something like really horrific, like cancer. It doesn't matter what sex you are or what age you are. All of the drugs that are used as blockers are very, very strong. When I see kids going on blockers before they've matured sexually, obviously, it really disturbs me, because if you don't have a connection with your sexual self and you can't see yourself in a sexual setting with other people, how do you know you're making the right decision? Like, how you never gave a chance, you never had a chance to be connected with your body before you rejected it. And also, blockers are they're not reversible. Like, if somebody never sexually matures, you can't just make them sexually mature later. Yeah, they are not reversible, and there is no long-term studies, because it's all off-label use, right? So there's no actual long-term studies of like, 10 years after hormone blockers, how is somebody doing? But there is some long-term studies on the drugs that are used, on like their actual proper usage, and they all have like horrific side effects. So just be aware. I don't think anybody should take blockers unless it's like a very extremely serious medical situation. Yeah. Testosterone. So I think people don't really consider how powerful it is, and like the possible negative effects it could have on you. So for some people, it really affects your eating habits and your cravings. And if you had an eating disorder before, or body image issues before, imagine how that will have an effect on you. It increases your libido. So if your libido and sexual feelings were tied to your dysphoria, that could be literally increasing your dysphoria. It also grows your clitoris. So if you were uncomfortable with your genitalia, now your genitalia is growing. Like, are these things helping your dysphoria? And if you felt like you weren't in control of your body before, is this helping you feel in control of your body now? Like, I'm not being judgmental, I'm just saying. Also, testosterone increases your chance of like cervical cancer, breast cancer, ovarian cancer. But in England, if you're trans, like female to male, and you get your gender marker changed in the healthcare system, then you're no longer eligible for breast cancer screenings or cervical cancer screenings or the HPV shot, because you're not a female anymore. So this is like the kind of stuff to consider before you take these hormones. Also, it's irreversible. Like, if your voice drops, you can't fix that. If you grow facial hair, you'll have to get electrolysis. Like, it's not reversible. And there, again, is no long-term studies of how this will affect someone, especially if they're starting T at like 14. There's no long-term studies of how that'll affect someone. I don't know much about the male to female transsexual side of hormones, but it's chemical castration. So if you actually had a positive sexual relationship with your body, you're castrating yourself now. Is that what you wanted? And also, if you grow breasts, that's not reversible, man. Like, you'll have to have those surgically removed. Yeah. So all of these things like have a huge effect on your body and your mind and the way you live your life. So just go slow and ask as many questions as you need to. There's no rush to get into these things. So it's possible that after taking hormones and socially transitioning that you're happy with your body now and you feel like you've transitioned and that's it. If that's how you feel, don't let anybody pressure you into surgeries. Yeah, but I'm going to discuss surgery now. So, first of all, it's a huge, huge, huge deal to get sexual reassignment surgery. Anybody who minimizes that doesn't know what they're talking about, or they're literally lying to you. Like the aftercare for a vaginoplasty is so extensive that surgeons literally prefer to do it to males under the age of 18 while they're still living at home with their parents, because, like, if you watch there's some adults who've had vaginoplasties who'll go on YouTube and say like, oh, I can't keep a job now because I have to dilate this many times a day and I'm in this much pain and I'm taking all these meds. Like, I can't keep a job. So, like, it has a huge effect on your life, obviously. Any type of bottom surgery will affect your ability to be aroused and your ability to climax, which in turn will have an effect on your relationships and your intimacy with your partner. So, like I said, if you've never been in a relationship and you've never been sexual with someone, you can't even know how things would have been or what a real, like, orgasm with someone feels like or something like that. There is People often minimize the amount of like follow-up surgeries and complications that can arise, especially from phalloplasties. Um, the rates of complication is like pretty high. Um, and with all of this stuff, you don't know how it feels until you get it. You can imagine you know what having a penis feels like. You can wear a packer or whatever, but until you actually have it done, you don't know how it feels. So how do you know it's going to be better or worse? How do you know that's going to be the thing that fixes your dysphoria? Like, if your dysphoria involves you imagining you have a real penis and then you get surgery and you have like a pseudo penis, is that going to actually make you feel better? I'm not being judgmental. I'm just asking you. Like, some people, they don't really like know what they're getting into. They'll post on Reddit like, I have no regrets, but then they'll be like, my penis is so heavy and it pulls on like all the skin from my stomach and it feels so weird. Like, I didn't expect that. Or I'm in constant pain, I can't move for like a month. Something like that. Or some of the most sad ones I've seen is like a trans woman who they got a vaginoplasty after getting like every other surgery and they just thought they would like finally feel like a real woman. But after the surgery they still felt like a male who's had a lot of surgery. Um yeah, so you can't know how it feels until you get it. I don't think you can just pray you'll feel better and then you get it and you'll feel better. I think you need to do a lot of soul searching and a lot of research before you get SRS. Um, like, talk to several different doctors, talk to several different people who've had that surgery, talk to people who've experienced the complications, talk to people who've experienced the follow-up surgeries. Yeah. Also, just like with hormones, there is no long-term research on this, so there's like no plan for how you can age with SRS, which is concerning to me because they're giving SRS to like people under the age of 18. Your body grows. Like, is there a plan for like follow-up surgeries to help your like, this organ is not going to grow naturally because it's not naturally there. I don't know, like, I don't know. This, it really concerns me. And like the aging process, like, is there a medical plan for geriatric trans people after they've had all the surgeries? Like, at what age do you stop dilating? When they're 90? Like, at what age do you stop taking testosterone completely? When you're like 85? Like, do you know what I mean? There's no long-term research on this. Also, I know of one clinic specifically in Serbia that does sexual reassignment surgery, and the same surgeons who do that also reverse sexual reassignment surgery. So, like, think about that. The fact that those surgeons do both surgeries, that's telling you something. Like, really, really take your time with this before you make this decision, because it is a huge life-altering, irreversible decision. Yeah, so I think a lot of people need to consider, is this mental health problem going to be solved by a physical solution? And I don't know, like, maybe for you it will, and maybe for you it won't, but really you need to consider that. And like, after every like step, after you've like gone to therapy, after you've addressed your dysphoria in therapy, after you've tried being gender nonconforming, always ask yourself, is your life easier? Is it getting better? Is your dysphoria more manageable? Because that's what your goal is. Your goal should not be, oh, I need to be a man and get all the surgeries. Your goal should be, I want to live a happy, fulfilling life. Because the more surgeries you get and the more hormones you go on and all that kind of stuff, it accumulates. It has an effect on your body, it has an effect on your mind, and it's really expensive. So just consider what's going to be the easiest way for you to live your life. Because at the end of the day, what's important is the outcome. So, is your connection with your body and your sexuality better now than it was before? Is your life easier now? Do you have a more clear goal of how to live a fulfilling and happy life? Is your dysphoria less? Is it like a day-to-day problem for you? Hopefully, after you've taken these steps, no matter where on the journey you ended up, you'll have more coping skills for dealing with dysphoria. Quickly before I end this video, I just want to go over some narratives in the trans community that I find to be very harmful. So, the first one is transition is destiny. There's this idea that if you're dysphoric, then you're trans, then you'll transition, then everything will be better. Like, no. For some people, like, what if your dysphoria was caused by a sexual assault? Is transition the right path for you? Like, I don't know. I find that to be doubtful, but you should explore it. Or for some people, you can be dysphoric and transition, but you don't have to do medical transition. Like, it should be up to the individual. It shouldn't be, this is what all trans people experience. People who perpetuate this idea of transition or suicide, it's super, super ridiculous to me. Like, a lot of us are suicidal or have attempted suicide, but often it has to do with like other environmental factors or other mental health factors, not with your actual dysphoria. So, and also like we know how suicide spreads, especially with impressionable teens. Giving them the idea that if they can't transition, they're going to kill themselves is very dangerous. I find it very disturbing. I think also we need to keep in mind that this is not like a social justice thing. This is not like you were born this way and it's your identity or something. This is like you have dysphoria and you want to learn to live a happy life with your dysphoria. I think the whole social justice thing has completely hijacked that this is like a mental health problem. Yeah. And then one last thing. People who transition without dysphoria, what are you doing? Like, literally, what are you doing? It's like if somebody told me they have PTSD, but they've never experienced trauma. Like, it doesn't make any sense. What are you doing? What are you saying? It doesn't make any sense. A few days ago, I saw somebody post a link about a detransitioned woman who had had a double mastectomy, so that's top surgery. And they regretted their top surgery. And some trans person commented, like, oh, this stupid detrans person, they wasted the time of surgeons who could have been doing surgery on a real trans person. And all I could think was, like, this person was obviously in so much distress that they thought the only way to fix it was to get surgery. They were never offered any solutions, any other solutions. Nobody ever asked them questions. Nobody ever really explored what was going on. They just gave them surgery. And now you're mad at this person that they took the only path that they thought would make them happy. And at the same time, these people are advocating that people without dysphoria need surgery and hormones. Like, you can't argue that hormones and surgery are life-saving because dysphoria is deadly, while at the same time validating trans people with no dysphoria whatsoever. It's just completely, like, mind-boggling to me. Yeah. So I just want to end this video by saying that you have a choice. You have the power in this situation. You might feel like your dysphoria is you have no control over your body. But the truth is, you have the control. You can choose, you can choose, like, am I capable of coping with this with clinical help? Do I need social transition? Do I need HRT? Do I need SRS? Like, it's your choice where you want to be and how you want to live your life. Yeah, so that's how I'm ending my video. As always, if you have questions, comments, or ideas for other videos, put them in the comments. I will put my Patreon and my PayPal in the description. And yeah, thanks for watching my video. I hope you enjoyed Momo lying there. Okay, bye.